Good morning, students. I hope that you are ready to start our week. Um, in today's activity, we are going to be doing science, and then we need to read a little bit. We need to read a few things, notes, and then we need to do some little research to complete our activity. So, we are going to look at anemia. Anemia in Spanish, anemia. And then there is a disease that many people have, okay? Even kids can get this disease. So what is anemia? Anemia is a condition in which the amount of red blood cells in the body is decreased below normal for your child's age. It can make your child appear pale in color and feel cranky, tired, or weak. So you see, students, they're supposed to be careful about anemia. So by the end of today, when you finish anemia, you will be able to know what to do so that you don't get this disease. Okay, now here we have some causes. What's going to cause anemia? 1. Genetic factors causing anemia. Excessive bleeding. Okay, excessive bleeding will normally come for females who will have their menstrual bleeding every month. Okay, and this is a way where they lose a lot of blood. Iron deficiency anemia, that's whenever you don't have this special mineral in your body. So if you don't have it, you start creating a disease known as anemia. Cancer causing anemia. So as a result of having cancer, then you will create another disease which you know as anemia. Impaired metabolism of spleen and anemia. So this is the way that your body consumes food. Okay, las causas, qué cosas causan la anemia. Okay, these are a few things here. There's more, right? Now, symptoms of anemia. Symptoms means things that will tell us, you know what, you are having anemia. You make sure that you watch this disease, check a doctor. The eyes are getting yellow. Look at it. So when your eyes are getting yellow, that's a symptom that you might have anemia. Paleness means that, I will say it in Spanish, it says pálido. Okay, coldness. You will have respiratory problems, muscular weakness. So when you do a short exercise, you will feel weak and tired. Okay, change stool color. Your stool is the waste that you take out in the bathroom. Okay, and look at the fatigue. So a lot of things comes with weakness, which will cause fatigue, dizziness, and so on. Low blood pressure. We have rapid heart rate. Okay, so maybe you're doing exercise and your heart rate starts pumping very very fast, more than normal. Chest pain, and you may even have a heart attack. All right, and enlargement of your spleen is all part of your body organs. Okay, what will doctors do if you have anemia? And it depends. Here it says it depends on the type, the causes, and the severity of the condition. So with every disease, it also depends on how advanced the disease is. But treatments may include dietary changes. What is dietary changes? Dietary changes means that you're going to change the way you eat. All right, either you can start getting some supplements, medicines. You can even go through surgery to treat blood loss. Normally people will do a blood transfusion. What is a blood transfusion? A blood transfusion is a common procedure in which blood is given to you through an intravenous line, IV as how we know it. It's one of your blood vessels. Transfusions require careful matching of donated blood with the recipient's blood. So if you're going to have a blood transfusion, let's say you're type C, then the blood that you're going to receive needs to be type C. So that, like, if you're going to change all your blood, right, you're going to go through a process. So we don't want to go all through that. Now here we have remolacha. These are the home remedies. So in the past, or even today, we have our great grandparents, our ancestors used to have these because the doctors were not so advanced in medicine. So remolacha, eating remolacha at home, and then there might be different ways of preparing it. Chaya, how many of you like chaya? I enjoy my chaya with flour, with corn tortilla and egg, right? That can put up your blood, the blood counts in your body. The spinach, la spinaca, beetroot. See, you see here, this one here, a beetroot, and here it's telling you what to do. Grind 1 beetroot, 2 carrots, and half sweet potato in a juicer. Drink this juice once daily. So instead of having a Coke, you might want to prepare one of those smoothies there. Apple, right? So if you have your apple a day, it keeps the doctor away. Sesame seeds, banana, that's are very common in our community. So if you consume of that, then you can work on building your blood count, right? So all of these are treatments that we can do at home. They are called home remedies. Now students, you will go to your activity there. You will see a little table like this, causes of diabetes. So now you're going to go and do some little research. Since you have your phablets, you can do your little research and causes, and then you're gonna write about 3 or 4 causes of diabetes, scale of causal. And then there are different types of diabetes. You go to diabetes type 1, and then you put the symptoms. Okay, the symptoms, and you don't have to put everything that you find on the, you put 4 of them, and then you go, what are the treatment or the recommendation the doctor is going to do if you have diabetes, and then again you put 3 or 4 treatment. And then here is where we need to try to interview our parents. I know that there's many people around your community or neighbors who will have diabetes. So you ask them, what do you do to keep up with your diabetes? Okay, those are called the home remedies, not what the doctor tells them to do, because the treatment by doctor is going to come here. So if you have any other questions, students,